John is back with us, and now we'll open the questions. Please remember that you can continue to vote, upvote questions that you're interested in, and of course, place new ones. We got about 25 minutes, so it's a good time, to further dig into the experience and the contribution of our two wonderful presenters today. The first one comes from Genevieve Cartillier, and it reads, in line with your argument that there is a misled focus on the brain to understand and support the healing of trauma, how can clinicians work more closely with social protective or corrective professionals to support survivors? I think that's primarily directed to John, but you can both join in. John, would you like to go first?
Well, I think as I said in my talk, I think the social institution that we most need to put support into is the educational setting. And unfortunately, there's been quite a bit of energy put into mental health in schools, but I have to say, I think it's misplaced, because a lot of it's leads teachers to expect that they're meant to identify mental health problems in kids and steer them towards appropriate resources. And I don't think it's what teachers should be doing. I think teachers should be teaching and providing pastoral care. And when they do that, they enhance the mental health of young people. So, there are people going around doing lots of talking to teachers and the kinds of people that are raised in this question about, how to understand the brain better, or what are the impacts of trauma on the brain. And I can see why people are doing that, because they want to kind of get people to take it seriously and not be dismissive of it. But I think it robs agency from teachers and other workers if they're, are we asking them to perform sort of low-grade therapeutic functions when that's not what they're trained to do? We want them to perform high-grade teaching functions. So I think that the focus on the brain has done us a disservice. And that was a wonderful clinical presentation, and there's what it illustrates is that there are things to think about in relation to the brain, but as long as it doesn't crowd out or inappropriately sideline the social and the interpersonal.
Thank you, John. Anything you'd like to add, Holly?
Yeah, I 100% agree. Although I do think that working with teachers to help them understand when children are not in their thinking brain in relation to specific children can be really helpful. So thinking about my client, but also other clients who I've worked with, some of the most useful parts of my intervention have actually not been the individual work with the child, which in some ways for me is the easy bit, but it's the case consultation with the teachers around helping them. They already understand the child, but helping them to see how much of the child that they understand and they know. So this little boy that I talked about, school is his safe place. He's got stronger attachments with the teachers and the learning support there than he's had, I think, with anyone in his life before. So it's a really, really important environment, and helping the teachers to feel confident in their relationship with him and not feel freaked out about how important they are to him has been really invaluable for this little boy.
Thank you. We'll move on to the next question, which is from Rochelle Williams, and reads, I love the play-based activities you describe using with Omar and his cousins. Please, could you tell us more about how you set up the puppet play Did you provide a scenario story and ask them to continue it? Or did you introduce a character and ask questions? Would love to try this with my clients. Thank you for the fantastic case study. And that's for you, of course, Holly.
You could do it either way. In this situation, partly because of time limitation, I didn't introduce a character. The only scenario I gave was I have a big bag of puppets and I emptied it on the table, and that's quite exciting and probably a bit overstimulating. Take a bit of time for each of the kids to choose one and choose a character, and then invite them to work together to create a story. And I just did a story of a journey to a safe place. The more structure you can give to it, I think for kids like this, probably the better. But it depends what time you've got, and I had limited time. I'll leave it at that.
Thank you. Next question comes from Ronald Ho, and it reads, thank you, Dr. John, for your insights. I was wondering about how you approach and navigate what you discuss about understanding what has happened to people and their stories, and that being the focus versus the need for categorical diagnosis, whether DCM or ACD, within our systems, often to then obtain further supports for example, schools and the IAS, etc.
Well, I guess I don't go near diagnoses unless I have to, and the have tos are, as has been identified, for the gateway into services in Australia is through diagnoses rather than through functional assessments. It's different in New Zealand, where, as I understand it, extra services in schools are based entirely on a child's needs rather than whether they've got a diagnosis or not. The other thing is whether, it can work in the other direction. You need a diagnosis to get the service, but also if you make a diagnosis, your thinking is going to be skewed more towards what's the treatment for this diagnosis, what's the service that's going to meet this child's needs, rather than what changes need to happen in this child's environment, what sense can be made of their distress, and what growth can come out of this intervention. So it's not sort of straightforwardly a good thing always to connect children up with services. Like, often it is, but sometimes it's not.
Thank you, John. We might go to the next one, which is from Ali Ahmed regarding OMA and boundaries. Would you provide how you work with this? For instance, did you give him the putty? How did you approach him while he was having the tantrum? What did you say?
All really excellent questions. I often didn't have a choice, but he had already taken the putty. So often what it looked like would be, how to describe it really quickly. There was a whole lot of play between moving from the therapy room back to his classroom, where he was performing begging, throwing himself on the floor, telling me he was going to take it, telling me he'd get me in trouble. And my response, most of the time, the response I tried to have was to stay really calm, kind, firm and clear, and let him know that I'm really sorry, but the putty lives with me. I'll keep it safe for you until next week. You need to give the putty back. And maybe the first couple of sessions, the teacher got it, or he gave it to the teacher when he got back to the classroom, and she gave it to me. And then each week, it was quite playful. Each week it became easier and easier. And in the last time before the big tantrum happened, he tricked me and he had it in his hand, and I thought he hadn't taken it, and he had it in his hand. And just as he went back into the classroom, he went, look, and then gave it back to me. So it was kind of, I think, important to keep it light, but to be really firm and consistent. And I did at one point say, if you don't give me back the putty, I won't be able to bring it next time. So I guess that's as punitive as I got, but that was the way of saying to him, look, there will be, if you steal my stuff, there will be consequences. I didn't put it as harsh as that, but it felt like there was a really important kind of relational thing that he was playing out through this, that it was important that I contain it, but also stay playful with it. When he had the huge big tantrum in the middle of the session, it was a bit more difficult. It was quite physical. Like, I grabbed the putty and held it up in the air, and he was jumping. He was like really gently pulling my hair. So doing this performance of like, I'm really going to get you, but testing it out. So it wasn't a complete dysregulated tantrum, but it was really trying to see how much I could tolerate, how much he could get away with. And then he grabbed my phone and started calling 000. And so I really had to work really hard to not lose my thinking, not laugh a little bit as well, and not get cross, and just acknowledge that he was really cross. And eventually he calmed back down. Yes, I am really cross. And then I negotiated with him swapping to give him some blue tack, and that was it. But it was important, I think, for me to stay in touch with how it felt in the session, how I felt, and what he was showing me of what he felt, and to be able to be in that and also think about it at the same time, which is not an easy thing to do when a kid is pulling your hair and calling emergency services.
Not an unusual challenging working with children. John, any comments you want to make on this topic?
I mean, just, yeah, I mean, it was an amazing piece of work, and congratulations, Holly, on surviving that, because that's what you had to do, and you did. And you know, the aim, the aspiration of maintaining some kind of lightness of touch in the face of the awfulness of it, that you don't get sort of dragged down into the mire of it. You're not trivializing it, not and just the other thing I wanted to say about your work that just reminded me of something that I should have said in my talk about the importance of helping children's imagination to grow. You know, that, and this is one of the things that schooling does, the same things that grow academic achievement, grow imagination. And it's through imagination that we're able to, I mean, what this little boy faced was insurmountable. And yet, with the use of his imagination, he can begin to chip away at making some sense of it. That's what worries me about screens, not just iPads, but televisions and screens in general, that they make us passive imaginers. We don't have to do any work to imagine things when we're confronted with the screen. And you know, the richness of that puppet play that Holly's talked about, you know, I bet overwhelmed parents at home, I bet screens are playing a really big part in managing these 4 difficult children. And that's at a cost to their imagination and therefore their recovery.
Thank you, John. We'll move to the next one, which is not addressed to either of you in particular, but maybe both of you can have a go. And it reads from Ross Whitfield, and it reads, where does the role of family therapy work in with your work, please?
Well, for me, everything I do is family therapy, whether I've got family in the room or not. I'm always trying to be mindful of the whole family in what I do. I mean, Holly's little boy spectacularly didn't have a family, but he has an imagined family and a surrogate family. So I think it's got to be there all the time. If you lose it, I think you're really going to struggle.
Holly?
Yeah, absolutely. And, you know, we're thinking not just about family, but about recovery environment. So I talked about the importance of school for this little boy. One of the ways of trying to engage and work with his carers was through school. They've not got a lot of capacity to engage in their own individual work or family work yet, but I see it as stepping stones. You know, working in a mental health context, we used to talk all the time about how children would bring their parents to therapy. We often would start a piece of work with the child and then engage the parents further down the track in the, I was going to say in the real work, and join them together. Working with refugee children, we're thinking in a similar way. We're thinking about the whole environment and all of the different elements of it, and the work just with the individual children, as rich and as poignant as it is working with the child's imagination, the environment that he goes back out into when he goes home is far more important than what I'm able to do in the therapy room. And if we've not got some stabilisation there, it's not going to go anywhere.
Thank you, Holly. And there's another question from Rochelle Williams, addressed to you, Holly, which reads, please could you also share a bit more about how you work with Alma's caregivers and anything that was specific to consider culturally or based on the refugee experience? Thank you again.
It's a hard question to answer in this context. For reasons that I won't go into, I haven't been able to do a lot of work with his caregivers, but I have been able to work with school. And so I think in my mind, sort of like I just said, it's stepping stones in my mind, and working with sort of settling the anxiety in the system at school has been a really important first step. He's got really good relationships with actually some of the school leadership and his immediate teachers. So that piece of work has been, if you like, a bit more accessible at this point. And working with the carers will come next.
Thank you. Next question we have in line is comes from Caroline Hosteta, and it reads, Holly, how did you introduce and facilitate play with both puppets and Patty?
It's actually a really good question, because kids like Omar often have never been played with and never had the space to play. So it's not something that comes automatically. I don't know if I can really remember about the putty, other than the snapshot that you saw when he first came into the room. He gravitated towards sensory toys and just started pulling them and actually kind of looking at me and seeing what I would do. The puppet play, I introduced it by making it appealing by taking out all of these amazing puppets. That was a bit overwhelming for Omar and the boys, so I had to scale it back down and scaffold it a little bit. Other examples, I think, of playing with Play-Doh, Omar's a really good artist and he's a really good mimic and copier. So he would make Play-Doh creations that copied the pictures on the packet, and it took quite a bit of time and sort of gentle interaction and me being quite playful and like finding my inner child, if you like, to encourage him to break the rules and create his own new creations. So like playing with creatures that he'd made, and they were playing football, and then a leg would fall off and then that would become something playful and we would kind of play around with that. So I guess attuning to where the child is and being really playful in yourself with it. I don't know if that answers the question, but that's some thoughts.
Thank you, Holly. The next question is from Rosalind George, and I think it's addressed to both of you. How do you work with your emotions and boundaries when you deal with difficult situations and clients? What do you do to help yourself with self-care? John, would you like to go first?
I belong to the school that thinks that it's helpful to have had your own therapy. You've got to have a peer group that you can talk to, or sometimes it's a peer group, sometimes it's a supervisor or mentor. It depends on the stage of your career, but you're never too old or experienced to seek supervision. And if you're going to help other people with relationships, if I'm right in thinking that it's all about relationships, then my own relationship should be in good order. So I've got to I'm fortunate that my relationships are in good order. So that's what protects me, I think, in my work. But also I have to say that I have to ration the amount of clinical work that I do. Like, I couldn't be like some people doing this kind of work 5 days a week. Some people can. I can't. You need to know that about yourself, I think.
Thank you. Holly?
Look, 100% agree with the importance of personal therapy. I think it's really difficult to know yourself well enough in those kind of heightened situations. It's really primitive kind of emotions that get evoked in us by these kids who've experienced the things that they have. And I did quite a long training program to get where I am. The biggest part of the learning for me was my own therapy, and I kept that going for a long time, and I dip in and out of it. And then from that, I think there are two parts. There's what do I do in the moment to look after myself? What do I do in between sessions to look after myself? What do I do at the end of the day to reflect on what I've learned, what I've taken in, get it out? And what do I do on a weekly basis to just keep my health and my resilience and flexibility going? And for me, it's mostly about breath and feeling my feet on the floor, those really simple kinds of things. But definitely having other people, supervision, support, and having a history of having built some understanding of what my own pressure points and relational patterns are is really, really helpful, and I continue to learn.
Thank you. Thank you both. Next question comes from Zina Jawad, and it reads for Holly: how did you maintain the lack of culturally appropriate skills? Which I suppose addresses, with us the issue of culture. Camina, how do you deal with it, I imagine?
Look, it's a complicated question. One of the main supports has been working with the same interpreter all the way through. And she is both a cultural interpreter as well as a language interpreter. And it's really clear to me how much the boys get from having her there, because if she can't make it, and she usually lets us know beforehand so the boys know, because she's attuned and knows what they need, they're less open if she's not there and they have to use a different interpreter. That's the easiest way to describe it, I think. So it's and it's working closely with her before and after sessions if there are things that I've missed or things that were inappropriate or things that I should be thinking about. And it's also really appreciating what she brings to the space in terms of the relationship, the three relationships, three of us all being in relationship. Yeah, there's a lot more to say, but it's a big question, so I'll leave it at that.
Yes, and John, any comments on this whole issue of culture and the role it plays in working with children?
No, just Holly's point about the importance of interpreters and how in medicine generally how lazy we are or careless we are about the use of interpreters. About if somebody can say hello, we assume by speaking loudly they'll understand what we're saying. And it's an area that we really need to address generally across medicine, I think.
Yes, particularly with children, which is so often at the forefront of this cultural of the acculturation process, and also between the sandwich between the two cultures.
Yeah, having them doing interpreting for their parents, that's always a good look.
Look, there's more questions, and I'm sure that we would enjoy. We could continue to enjoy, the way that you're addressing a lot of these, very important but quite complex topics. However, my role as the facilitator today is to end this masterclass on time. So I'd like to thank you both. Certainly personally, but on behalf of the staff and on behalf of the 150 people that we had, up until a few minutes ago. I don't remember many presentations, many master classes that attracted so much talk in the chat. So you might want to have a look at that. But wonderful comments there. People basically really appreciating your contribution tonight. So thank you so much. Thank you again, Holly and John. It's been magnificent. I really enjoyed it, and you can see from the comments on the chat that everybody else did. Thank you so much. And of course, this will be recorded, so lots more people will be watching this lecture, I'm sure.
Thank you.
And thank you for being so gracious as to join us tonight. Thank you.